students.
Good afternoon.
So yes, today you are all excited what we are going to discuss. So before going into the topic, I would like to give some clues so that you will find the topic. And this procedure is mostly done in all the patients who come into the hospital, whether it is a OPD, IP, or might be in a post-operative ward, or might be even in an operating room. And this procedure is definitely an invasive procedure, and of course it is going to create a pain to the patient. And in this procedure you can give the medicines up to 5 ml and not more than that. And this procedure will have certain side effects such as pain, and might be if it is done in a wrong side, nerve injury. Can you find what is that term? Injections. Yes, you are right. Can you please open up the mask and sit together? Injections. So what type of injection? Only up to 5 ml you do. So can you guess it? Yes, Sona? No, now I am not asking about the medicine. Only up to 5 ml you can administer, whether it is antibiotic or anything else.
Are you?
You're right. Clap hands for her. You are right. Insulin you can't give up to 5 ml. The patient will collapse and die on the spot. We are going only to give in units. And more than 5 ml if you give, that area can develop abscess. So in case if it is an IV, it is going to be in ml or liters as well. 1000 ml or 1 liter you can transfuse. But this procedure is invasive, I told you. It's going to create a pain and not more than 5 ml. So intramuscular injection. So of course this is one of the method of medication administration, which is parenteral administration. Para means other than the normal route. So other than the normal route, what is the route we give medicine? Anyone from the group? Yes. Can you try? Enteral means what? Through the GI system. So parenteral means other than the GI system. So why I have taken this IM intramuscular injection is that I would like to discuss a case where I came across my career field. So there was a patient who came into the emergency room, and he was around 46 years old. Okay, and maybe this case, what happened is that he was having nausea, vomiting, and of course some amount of pain was there. So the medicine was very much prepared, and the thing is that when we were going to administer the medicine, the patient didn't knew that he was allergic to the drug, but we are given the full dose through intramuscular injection. So after then he was identified, he developed immediately the anaphylactic shock, and there was a code blue announced, and we somehow revived the patient where he was allergic to paracetamol. So always I would like to tell you, taking this case scenario into existence, what are the do's and don'ts for giving the intramuscular injection and how we can prevent such type of assaults. So this is a small event which I am telling, that is developing a code blue or cardiac arrest just because of a small medicine. Might be the patient is allergic and the patient is not aware also. And on the other instant, if the nurse is not aware of what is the structures behind or where the site we have to give the intramuscular injection, then they can develop nerve injury. So in case of nerve injury, especially if it is being given into a pediatric, what will happen? Full paralysis. Palsy will develop. So the child cannot use the extremities because all the vaccines are given in the rectus muscle. But there is high risk for developing anterior rectus muscle. So baby can develop such sorts of paralysis. So today we will see in detail how we are going to do the intramuscular injection. So intramuscular injection, we know intra, it is inside, muscular is inside the muscle. So as I told you in the introduction itself, we are not going to purge more than 5 ml. So how much ml can be given to which site? Depending upon the muscle mass, we can maximize the ml. If it is in the deltoid region, you can only go up to 2 ml, not more than that. If you are going to purge 5 ml again abscess will create. Then if you are going to give it to the gluteal maximus muscle or ventrogluteal muscle, in that area you are going to give up to 5 ml. So these are the major what to say prominent sites. Of course, there are other sites such as rectus muscle which is present in the pediatrics. We give in the anterior rectus muscle where it is not risky, but for an adult it is totally contraindicated. Anterior rectus muscle is nothing but a muscle which is going to cover all the anterior portion of the thigh. In case if you are going to deal with the adult, then you have to give lateral muscle. So lateral muscle is like the muscle which is Vastus lateralis. Very like your quadriceps muscle, your thigh muscle will form a groove, and in that groove you will be giving the third. You will be dividing 1, 2 and 3 parts, and the middle portion will be the first location. For example, if this is the thigh, then you are going to locate the bone of the patella, then the bone of the hip bone. Then you divide into 3 according to the length of the femur bone. So 1, 2 and 3. 3 portions are there. So outer aspect, not in the anterior. For adult, not in the anterior. For pediatric, you can give it onto the anterior portion. In deltoid, of course you know, you will feel the acromion process. Just 2 inch below the acromion process, form a small triangle, and that triangle base is your deltoid region. And if it is ventrogluteal, or you call it as the anterior aspect of the gluteal muscle, so always you divide the buttock into 4 regions, and always it is given in the upper outer quadrant, not on the lower quadrant. Why not on the lower quadrant is that you have the nerve, peritonial nerve. That nerve can get damaged. So that's the reason we are giving in the upper outer quadrant. So just imagine if this is the buttock, just divide into like a plus you divide. So this portion is not given. All these portions you divide. Only the upper outer quadrant is given. Whether you are standing on the patient right side, then the upper outer quadrant of the right side, on the left side, then upper outer quadrant on the left side. So now I wanted to give you one small game like this. So can you find why it is all these injections are given in such a way, and what are the layers? Can anyone guess it? Pass it to the group. Yes, get up. You can try. What is it? Just tell what are the pictures located over there. Loudly.
Intramuscular.
Yeah. But why the needle is given in different angles? Can you find it out? Yes, she wants to try. Please give it in the front. So I would like to just first coin the terms. So this brown color portion is the muscle. Then you have a pink color portion with adipose tissue, which is the fatty layer. Then you have a small peach layer, which is the skin. That is the dermal layer. So now, can you identify which is going to be the intramuscular injection? Very good. Clap hands again for it. I think that she is only studying daily. So 90 degrees. So straight like a pen, you are going to insert the needle. The other 45-degree angle, here it is only landing up. You can see the tip of the needle is landing only to the subcutaneous layer. The other one, it is like sliding through the skin itself with 15-degree angle, which is the dermal layer. Subcutaneous and dermal layer we will see later. So keeping in mind, see that all the intramuscular injections are given like a pen-like shot. You have to hold the syringe in such a way, pen-like thing, and tell that the patient will have a mild pain and give the medicine. Yes. Now you read the first point. So how the standard operating procedure works? How we are going to give the medicine? Doctor has ordered injection paracetamol 500 milligram, might be not 500, 2 ml iron. Yes.
Review medication order, patient identity.
So first point is review the medication order. whether doctor has given the exact drug, compare it, whether it is there in your trolley, medication trolley. Then patient identify the patient, okay, whether take the paper or the patient record, medication record, identify, okay, Adira, okay, right. So I am with the right patient, OP number 9236. On the patient ID tag 9236, then that is the right patient. Second one.
Explain the procedure to the patient.
So what you are going to explain? You should not explain the procedure to the patient to your teachers or might be in a hostel. You have to say, Miss Adira, if it is a Tamil patient, talk in Tamil. If the patient understands English, talk in English. So keeping now in the Tamil Nadu, we speak in Tamil, right? So Adira, உங்களுக்கு மெடிசன் கொடுக்க போகிறோம். உங்களுக்கு இன்ஜெக்ஷன் பேராசிட்டமால் அட்வைஸ் பண்ணியிருக்காங்க ஃபீவருக்கு. கொஞ்சம் வலி இருக்கும், நீங்கள் லூசன் பண்ணி இருக்கணும், நான் இன்ஜெக்ஷன் போடும்போது கோஆப்ரேட் பண்ணுங்கள். ஏதாவது டிஸ்கம்ஃபர்ட் இருந்தால் சொல்லுங்கள். These are the things you have to communicate to the patient. So if the patient is not have any discomfort, relaxing the muscles and not holding the muscle tight. If she is going to hold the muscle tight, the pain will be more and more aggravated. So that's the reason you are telling the patient to relax the muscles when we are giving the injection.
So dosage and amount of medication correct equipment.
So dosage. I give the doctors only ordering only for 1 ml. Then you have to take only half of the medicine from the ampule, not the full dose. Okay, according to the dosage order, you are going to dissolve and prepare the medicine.
Wash hands and do gloves, prepare medication, amputation and medication.
Ampules and hands. So depending upon whether it is from the vial or from the ampule, wash hands and everything is kept ready to the patient's side, and then you are going to start the procedure.
Provide appropriate position as to relax muscle.
Yeah. So you're going to give privacy as well as attenders can be let outside and you can provide a screen, as well as you're asking the client to relax. If it is the deltoid region, ask the patient to in a sideline position or in a supine position. If it is on the gluteus maximus. If it is on the deltoid region, the patient can just sit on the cot or couch and take the medicine. So depending on the site, you are going to position the patient, relax the muscle. Then
Clean site with spirit swab.
so this is like skin decontamination, removing the unnecessary debris from the skin using the alcohol swab.
Axial pinch and the area, hold a syringe.
So for deltoid, you can't go and give just a shot like this. Instead, you have to grasp the full muscle in such a way you're holding the muscle. So the patient's muscle will be under your control. Right? How hard I am holding your muscle, right? In such a way you will be pinching the muscle, whether it is on the deltoid or whether it is on the gluteus maximus muscle. Then
Aspirate the
plunger. So you are going to aspirate the plunger to expel out the air. So there will be some amount of air in the needle. So that's the reason you expel out, as well as you checking for any sort of blood streaks. If it is a blood streak, then you are not in intramuscular. In which side we are in? Intravenous. Some vein you are punctured. So if there is artery can be punctured. So if you withdraw, there should not be any blood streak in IM. In IV, if you put the cannula, if you do the invasive technique, there must be blood streak. Then you are in the IV one. But in an IM, there must not be any blood streak. Next. Sorry, okay. If there is no blood, you are only getting air out of it, then slowly you can inject the medication, talking to the patient, diverting the patient. You can ask, which dress, if it is like any new festival did they celebrate, did you buy any dress, what is your favorite movie. If you speak like that to the patient and giving the medicine, then they will divert themselves.
Remove the needle and massage.
So you can remove the needle and massage that particular site. Okay, now I am asking, if you see or come across there is a backflash of blood, fine blood, what as a nurse you will do? Sona? Is it an answer?
You have to withdraw the needle.
Yeah, stop the procedure, withdraw the needle, reassure the patient, and select another site. Don't go into the site and explain why the reason is. I'll tell you an example after the video is over.
Don't recap, discard to puncture, don't contain.
Yeah, immediately say that don't recap and try to puncture yourself. Instead, you have to discard the needle into the puncture-proof container, which is a white one with a closed lid.
Patient comfort, wash hands, record.
Comfort the patient, reassure the patient, and take all the articles to the nurse's station, wash hands, and record. Documentation is very essential. So by now you are clear with how to do an intramuscular injection, right? Is there any doubts?
Mhm.